Welcome to Drug Diaries. I'm your host Kaushik Trivedi, and today we have an amazing guest joining us. I'm thrilled to introduce you to Engers Fernandez, an executive technology leader and the VP of Innovation at Ochin Inc. With over 20 years of experience, Engers has established himself as a forward-thinking leader in innovation and digital transformation, particularly in the healthcare technology sector. His expertise spans across process automation, data utilization, strategic planning, and AI implementation. At Ochin Inc., Engers is at the forefront of leveraging technology to improve healthcare access and outcomes. Today, we'll explore Engers' fascinating journey in healthcare technology, his insights on digital transformation in healthcare, and his vision for the future of this rapidly evolving field. We'll also delve into his experiences at Ochin Inc. and learn about some of the groundbreaking projects he's currently working on. Engers, thank you for being here today. We're excited to tap into your wealth of knowledge and experience.
Thank you, Kaushik. Thank you for having me. I think by the time your audience is going to be listening to this, just to set the record straight, right? I will be with a new company as a Chief Innovation Officer for Next, which is I'm really excited about. Is a network of innovators worldwide from different industry that is looking to bring all this industry and innovations together to help to advance healthcare worldwide. So I'm very excited for that. In the meantime, yes, as a vice president of innovation for Ocean, which is an organization that my heart is still very connected with the mission. Just to clarify that record there, Kaushik, since
That's fantastic.
you caught me in the transitional process. So
Yeah,
go.
that's
Okay, so
fantastic. Sure. Many congratulations from all of us on your new break, and we wish you a lot of success. I'm going to begin by asking you to walk us through your career journey to becoming an executive technology and leader and vice president of innovation at Ochin Inc.
okay. Well, I have been fairly fond to technology since my early years, since I was in med school. I can still remember I went to medical school in Dominican Republic, the Autonomous University of Santo Domingo. At that time, electricity was not reliable. So just to give you an idea, right? So yes, we had internet and that broadband internet,
Yeah.
and I remember that for me to keep up with what's going on in the latest when it comes to science, I have to purchase the books in English. Actually, I learned English through trying to keep up with the latest version of whatever was going on in medical science. And I remember like if it is today, reading my anatomy book and imagine that anatomy book and microbiology book coming alive. Like how easy would it be if I can interact with it? Uh, and since that imagination, when I had the chance to come to United States as a professional, not just as a visitor, I had the opportunity to bring that alive. But at that time, I was the director for a health center that it was a holistic health center in
Mhm.
Florida. And I had the opportunity to reimagine what patient education will look like. It was
Right.
the first time I was exposed to AI, predictive AI in this particular case, and RNN. RNN
Hmm.
AI is like, for those that probably are listening to the podcast, that is the grandfather of what we call generative AI today. So the tool had a very simple vision, which it was creating personalized patient education tools so you can engage the patient with their own healthcare and putting healthcare back to their hands. The technology was ahead of its time. I became the CEO. At that time, uh, we were able to be at the incubator for the University of Central Florida. And
Right.
in that connection, we won about $275,000 to start the. We put the proof of concept. We did a pilot, and so what we did, we combined it, this particular technology that we built, that we call Pangea, with an EMR system. And that
Mm-hmm.
our organization uh, ended up acquiring that startup that I used to. That's how I got in. That was my transition from medical doctor to administrator to technology administrator, right? But that's where my career shift
Right.
from a pure clinical now to a technology type of person. That guided me. Well, I did a few things. I founded another company, NeoEd, and then I ended up being the chief technology officer and chief information officer for Sakel System. Through that process, I met Ocean CEO Abby because I wanted to bring their Ocean EHR solution
Right.
towards Sakel System, and I fall in love with the mission of Ocean, and I fall in love with Abby privately, publicly. One of the best teammate I have ever had. I never felt with her like she was my boss, like a mentor. And for the last 6 years, I've been under her wings, learning how real life business, technology, and innovation really happens, especially for the underserved population. So for the last 6 years, I've been lucky enough to partner with
Mm-hmm.
many, I would say, the smartest people I have met. And today, I have to say I've been lucky that I have an opportunity to meet people like you,
Oh, it's a pleasure.
are in the forefront in bringing the concept of innovation forward, especially in the healthcare field,
Right.
which is an area that I think every humans agree we can do way more.
How, Angus, how do you define innovation in the context of healthcare technology?
I laugh, and I want to give your audience a kind of a genuine response, right?
Sure.
So it's really hard to define innovation as a concept because once you take that route, it's too generalistic, right? You lose the mark of what is useful. Innovation in itself is like defining leadership, right? You don't know exactly how to define it
Mhm.
after the global context, but when you see it, you know it, right? Like when you see it,
Yes.
you know it. The same thing with innovation. Innovation can live in many different states. So what
Mm-hmm.
I will do, probably provide you with some of the principles that I approach innovation,
Sure.
and that will give context, and then we can define it together, right? The first principle is in which I approach innovation is that not every innovation is technology, and not every technology is innovation.
Yes.
That's the first building block. As you, if you're moving into a career of innovation, especially in healthcare, that's building block number one. Building block number two, often when people think innovation, they think about everything that is going to be changing. And that
Mm-hmm.
is, in my experience, has been the wrong approach. I have done it, and I can tell you it doesn't work. Instead, you have to think about within the industry that you're facing or you're responsible of, what is consistent, what is constant, what always is going to be there. In the healthcare field, you have a patient that always is going to need some type of healthcare, either products or services or anything within that list that is consistent, that is constant, right? And then also consistent is that there always will be someone or something that it will be available to provide whatever level of healthcare that human needs. That is the consistency there, right? So
Right.
once you understand the consistency, then you move to whatever innovation is how to improve that environment. Now you have in healthcare, because you're asking me in healthcare in a specific, and by the way, this is industry agnostic, but since we're talking healthcare, then you have to see what are the trends that
Mm-hmm.
will enhance the relationship between the patient with his healthcare, and what kind of innovations or trends are making the life of that something or someone easier, faster in providing that products or services, right? We have building block number one. Everything that you're going to look from the innovation standpoint is got to be technology. Can be other pieces, right? The other pieces
Yeah.
is what is consistent for these two in healthcare, these two key players, and
Mm-hmm.
then last but not least, you have to constantly and never ending improving that relationship between those two players, right? Then when you put all that together, then innovation, and here's it's if those COO that have worked with me in the past hear me saying what I'm about to say, they're gonna say,
Yeah.
"I knew it," right? Like I knew I was thinking in that direction. Then innovation from that perspective is a collection of a step, and I don't want to say process. And I will say this, and probably you're gonna get some comments. Operations is where innovation goes to die. I'm going to repeat that. Operations is where innovation goes to die. That doesn't mean you shouldn't have processes in place, but if you operate too much, then your own process is going to kill the innovation and you're going to miss something. And there's many examples that we can go down that path. Now, with that, from that perspective, then you say innovation is the collection of steps that is constantly looking to improve the main characteristic of your industry. And you see, even when we define it from that perspective, it becomes too generalized. That has a different meaning for someone, even within healthcare, that is
Mm-hmm.
working biotechnology. There's someone that is working with the data, right? With the electronic health record.
Right.
So that would be my definition. Now, in healthcare, constant improvement comes in cycle. The one that comes to me is one that I learned from the University of Michigan. That they have been pioneers in the concept of learning health system.
Right.
And the learning health system, I'm constantly being inspired by it because it collects all the entire process that makes sense to improve health, not from the individual standpoint, but also from population health. And that comes with a cycle. It's through the learning health cycle. The learning health system live within the learning health cycle. And if you are a COO, CIO, and CEO, it's really helpful to see your processes from this perspective. The first piece is capturing performance to data. EHR do that fairly well, right? Then it comes data to knowledge. Now, that knowledge needs to have a purpose, and that's the last part of the cycle, which is knowledge to performance. The key is that from that data to knowledge, every organization should have its metrics in which when the data is being provided for improvement, that it will drive your innovation. You have to constantly be looking at it. In healthcare, what it matters is three areas. Obviously, clinical outcomes. The second one is operational excellency. And the
Mm-hmm.
third one, especially for organizations that their focus is to serve underserved populations, financial well-being. So whatever data, whatever performance are at the clinic or hospital should come to it and be analyzed from that perspective. How you can get better clinical outcomes, how you can get more effective in your operations, and how you keep the financial well-being.
Yeah.
So
Yeah. I
yeah,
was thinking the same that if I think there are three questions or four questions you need to ask whether it's helping you improve the clinical outcomes, or is it helping you reduce the cost? Is it helping you make the process simpler, or is it bringing about some radical change to the entire pathway or the value chain?
yes.
So I think that's pretty much my definition of innovation as well. And what do you think? What are the barriers to innovation? If we look at the healthcare sector, we say that we don't have or the
Yeah.
likes of Steve Jobs. Why is it that? Why do we not have those radical sort of innovations growing very quickly within healthcare sector?
It might sound like a simple question, Kaushik, but from my
Mm-hmm.
experience, it's loaded. It has a lot of components. It's not just one, there's many components. But from
Mm-hmm.
that perspective, to answer your question, the barriers. The first one is, which is really easy to see, is that the healthcare liability is really high. We're literally, no matter if you are patient facing, like a doctor or a nurse or a medical assistant, or in the back end as a, let's say, as an EMR analyst,
Right.
any mistake you can make in the process, it can impact other people's lives. So there is a lot of
Mm-hmm.
liability in the entire workflow, in the entire life cycle of a patient. So that's number one. Liability is really high. So we have to be really careful before we put anything in front of patients. So that's one. But that's one building block that I think leaders within the healthcare field, we need, I'm going to include myself, a little more bold in being honest in the things that we can do and we cannot do from that liability standpoint. But I'm going to put that aside for a second. The second piece is medical science is science, right? So our entire process from doing research to all the way to impact healthcare is fairly long for the same reason of the liability. And there is a lot of improvement that we have to make. Like now,
Right.
based on how fast we were able to produce vaccine to COVID, it showed
Yeah.
us that we can do more and we can do it faster if we know how to leverage the technology that we currently have, even not the one that is going to be a system. I'm very excited about it, but today, so we can do more there also. So that's a barrier. So the first one is the liability barrier. The second one is how long the process is. The third one, which is the one where I have been more involved, improvement. Every industry has a core technology. In healthcare, that core technology is electronic health records, right?
Yes.
So if you think about it, the top three electronic health record in the United States, the backbone of that technology stack was created based on technology developed in the 1960s and the 70s.
Yeah.
Those are the top three. Then if you include the top five, the other twos, and I cannot mention any name for obvious reason, right? But the other two have been built and launched in the 90s. So that technology was built in the 70s and 80s. So as this EHR system, they become ubiquitous with technology from the 70s and the 60s, it's really hard to design a experience that it is worthy of today's time. This is the reason why patients look at their phone and why is it easier for me to interact with any other application than with my own medical record. This is the reason why doctors, even the EHR that they love, the EMR that they love, they don't love it because it's the best experience that they're having. They love it because one is less worse than the other. One thing that is really taking us back is we have to rethink the EMR from scratch. We have to rebuild it from scratch. Then take those technologies that they exist today. We rebuild it from that perspective with enough flexibility, because we have learned a lot for the last 20 years that we have been really having EMRs trying to be ubiquitous. So if you ask me, the approach, that barrier of every time there is a new technology, create a Band-Aid type of technology on top of the old technology is not helping anyone. It's not helping those two. You remember I say,
Yes.
it's not helping the patients, it's not helping the doctors. Neither of them are really happy with the technology that has been built. Think about the following from that perspective. Then I'm going to give you the fourth barrier. Probably is going to prompt more conversations. We moved in the 90s into the web, right? The internet became ubiquitous and so on and so forth. And yet you use any of these EMR and they feel clunky. It's not the same experience. Then we moved to another transformational technology, which was the mobile technology.
Yes.
And the mobile technology through the EMR, horrible at best, regardless of the EMR. And then now we're moving into another transformation technology where this generative AI has brought forward a lot of potential, enhance the healthcare experience. And myself, that have been involved in implementing generative AI tools within EMRs, I can tell you it needs a lot of improvement. It will need a lot of improvement before we can claim this technology in the healthcare field to be utilized just the same way you're utilizing in any other tool. Then the last barrier, which is I think is probably one of the most important one, is Leadership. I think leaders should be, in my opinion, a little more curious about
Yes.
the impact of trending technologies
Right.
and how they're going to be impacting their business. Otherwise, we keep falling behind, especially in healthcare. And
Mm-hmm.
even more in organizations where they are developing or facilitating healthcare to underserved populations. These populations are the ones that need it the most, and they're often the ones being left behind by how fast the technology goes. I haven't
Yeah.
do this study yet, but it's one the ones that I'm going to be putting a lot of intention as I move into my new role as a chief
Right.
information officer is how many healthcare organizations have someone in charge of innovation.
Yeah.
If anything, the last thing year has shown us with everything that has happened in the world is you need to have someone looking at the trends
Yes.
so you don't get caught by surprise. It's amazing. I mean, let's be honest, no one knew, even those that have been involved in innovation and technology for the longest would have thought the generative AI would have the momentum that it's having today. It would be really hard to see it, but I think we should have been way better prepared to embrace
Yeah.
technology than where we are today.
Yeah.
Those four barrier, and I'm gonna go backwards. I would say leadership. The central technology needs to be
Mm-hmm.
definitely redefined. Then you have the liability in itself, and then the process that we create in order to minimize liabilities to launch.
Right. Right. Absolutely. Those are very good points. I think, in my perspective, there are some incredibly smart and talented people and organizations, the startups, who are coming up with some amazing innovation, but there's not enough of a business case for them to invest. It's not very encouraging. And there are several reasons, because it's a very complex and challenging process. There are several hurdles, right, from
Mhm.
obtaining the regulatory approvals to making sure that it gets reimbursed, and then it gets to adoption. So if we talk about regulatory approvals, of course, let's say someone comes up with a digital app
Yes.
for improving health outcomes. It has to undergo a rigorous scrutiny before it can be brought to the market, to make sure that it's safe and it's efficacious and it has clinical benefits. And this process of approval is painfully long, expensive,
Yeah.
and requires extensive clinical trials and data collection. Once you've gone past the regulatory approval, then comes the reimbursement. Who's going to pay for the innovation? So you essentially need to go to the healthcare insurer to make a pitch.
Yes.
And if they decide to take that innovation, they'll have to make sure that it becomes available for every patient who falls in that category. So they have to look at the innovation from three aspects. One is cost effectiveness, second is budget impact, and third is clinical benefit. And once you've done that, let's say you've crossed that hurdle, the next is adoption.
Yes.
So how do you make sure that patients adopt those technological innovations? So all said and done, I think it's a very complex process which requires a lot of investment, a lot of hard work and efforts, with no guarantee of success at all. And that's why uh, there's not enough innovation taking up in the healthcare sector. That's my
Yeah, that's beautiful, Kaushik. And as I was listening to you, it made me think. Right when we discuss these topics, is okay. At which level are we discussing the impact of innovation in healthcare?
yeah.
Okay, let's say in what you just described is looking at healthcare from a very this Western approach that we have here in the United States, and I bet also London, uh, that it is signs, symptoms, and then medications, right? And I read, gosh, I cannot quote it now, but I read a few months ago a study, and I actually I think I posted in my LinkedIn. I posted, it says what patients really want. The number one thing that they want is that they want the approach to healthcare, to their health, to be personal, right?
Yes.
Personalized care. And then they want it to be holistic. not just, I come to the hospital and that's it, or I come to do my annual checkup and that's it.
Mm-hmm.
The second thing that came out from that study is, and this is where I think I want to hit hard to the leaders listening to your podcast,
Mm-hmm.
because I think it is true, is although patients really trust healthcare organizations with their data,
Mm-hmm.
they're not happy of where do not use that data to really improve healthcare fast enough. And this is the
Yeah.
patient talking. So there is a trend around this, which is personalized care. Something tells me, as I'm analyzing trends and statistics, that this generative AI movement, where what is really driving the use of the technology is the end user, not necessarily organizations, which
Yeah.
in healthcare, organizations drive the
Right.
technology that is going to be interacting with the patients. I think that the entrepreneur person that is listening to your podcast, if that person finds a way in which you can leverage this technology, the mobile technology,
Mm-hmm.
where you in that form, in that technology, you can have the entire health record of a person, and that
Mm-hmm.
through that technology, wherever they go, they
Yeah.
transfer the latest and the greatest for from their healthcare,
Mm-hmm.
and vice versa from the record. Whoever gets to do that is going to do three things in healthcare. One is going to give the patient what they want, control on their healthcare and their information, because at the end, that information belongs to the patient. You can make an argument it belongs to
Mm-hmm.
science, to the organization, so on, which is true. But at the end of the day, my information as a patient is mine, and I need to have
Yeah.
access to all of it, not some of it. Ocean has, and I'm going to mention Ocean on this because one of the principles that make me fall in love with Ocean as an organization was there has to be one record for one patient. That's a dream. That's one of the driving force of the organization. But in order to do that, taking the traditional route where healthcare, electronic health record company are the one driving instead of the patient driving that, it minimize that. But personal, and as you see the trends coming along, humans, us, through
Mm-hmm.
generation, become more comfortable with the digital literacy.
Yes.
It's really easy to see how all that information, in order to help me actually have it in my hand. And now with all these wearable devices, right, constantly in real time,
Mm-hmm.
gathering information from me that my doctor doesn't know if when I go late night to my room and I'm walking up the stairs, what is the difference between my heart rate, my real heart rate, because the still up to today, now many organizations have in real time capacity to capture that information. But if you have AI technology, as is already is in this fund, capturing all that information and being able to predict a condition because it's capturing on the daily basis every single moment, that is one of the transformations that I dream of
Right.
with healthcare.
Yeah. I think that's spot on. And if we talk about, let's say, new technologies such as invisibles, and
Oh,
I also saw your article on
yes,
LinkedIn, and
yes,
as the luck would have it, I was doing this artificial intelligence in healthcare course from MIT, and I
yes.
was going through this lecture from Dina Katabi, and
Oh, yeah.
I
Oh,
found
yeah.
it fascinating. I found it
Yeah.
fascinating. I looked up the internet and I found your article about
Yeah.
the invisibles. And again, that's an amazing technology. And I think they are trying to use it in atopic dermatitis and things like dementia, Parkinson's, Alzheimer's, and number of other possible treatment areas or therapy areas. But again, access, when do these technologies become accessible to
Yeah.
the patients? I think that's where.
That was when as I was talking, I got myself and said, okay, talking about wearables. I think if any one of your audience go and look for that new technology, I think developed at MIT, where wearables are going to be things of the past, right? And the
Yeah.
technology basically is having a hardware outside of your house that is constantly gathering information, biometric information about your body, and then sending it directly to your doctor. We're not there yet, but they have been already piloting those
Yeah.
organizations. You mentioned the article that I wrote about, and my fascination was as the technology become cheaper, it's
Hmm.
going to be one of the key healthcare transformation that will happen with rural health. Those folks that they don't have a hospital really close, that they have multiple morbid conditions, and it's really hard for them to see the doctor, see the patient, that the doctor can have in real time data from the condition of those patients, and then really make an adjustment on treatment just by seeing how everything is working on a daily basis. I tell you, Kaushik, I'm
Hmm.
excited to be alive in this time, because as you
Yes.
can see, it's really easy. You don't have to be a professional innovator to actually start putting together many of these technologies and trends. And if you understand the
Yeah.
industry kind of fairly well, you can start seeing some of the core challenges that we have in healthcare now in providing access to care. And also from the other side, from the provider side, minimizing the burnout of the providers.
Yeah.
It's
Yeah.
really easy that all this technology at some point they're really going to make a difference. This is important for the discussion of AI and generative AI and how we see things changing in the future, right? We have created a financial model, humans, that is basically based on effort, human effort.
Right.
And that model, we translate that model, which is, although has been useful all this time, we can definitely see that the model is going to have challenges 5 years from, I'm not even talking 10 years, 5 years from today, because the incentive so far has been the doctor has to do something and touch the patient or whatever, then they should get paid more than actually the telehealth consultation. When the infrastructure of that conversation happening, you invest more in telehealth than the patient, being transported and so on and so forth. That's arguable, but there is some data outside that talks about. In US, then for a while now, we have been pitching, promoting value-based care, which is
What's that again? Audio.
value based care,
Value.
which is basically means the doctor and the healthcare organization will get paid based on the value that is
Oh, value.
providing
Right.
the patient, and not so much because you see me or not. Is, I mean, the concept itself is has been challenging the entire healthcare industry, because how now, let's define value for the patient, right? That's
Yes.
why this is important for the technology perspective. As I don't know if you remember, I tried to make a case
Hmm.
about when the patient is receiving healthcare is someone or something, because there are going to be a lot of something that is not human providing value to healthcare. So I can make that connection with what I'm about to say from an article that I read lately, that in the age of AI, now that the hype is start calming down, and we're seeing, okay, what actually can we do with this technology and what it is today popping up, which is
Hmm.
taking this large language model in a smaller version, kind of specialize them, utilizing rack technique to being hyper specialized on something. And that
Hmm.
hyper specialization will be the agents. And I know probably you have read a lot about these agents in AI, so on and so forth. But the important piece that is connected with value based care is organizations that develop technology that are going to be involved in this value based care. A new business model is coming along with it, which
Right.
is the result as a service, not
Hmm.
software as a service. Now it's result as a service. So if you are developing, if you come to my organization, my hospital, and you're telling me that this particular technology, this agent, is going to minimize 10% of the cost and so on and so forth, I will pay you based on the results that it creates, not necessarily in the cost of implementation of that. Think about that for a second. If that becomes a model, then the entire electronic healthcare record industry is going to get a shakeup. I have been in many conversations, and not once I have heard from any CFO, any CEO, any CIO, any
Hmm.
CTO, any COO the discussion of what are we going to do when these two forces meet each other, value-based care and results as a service, with the technology that we're creating, that we're providing, and so on and so forth. This is where the conversation should be. And I really, one of my incentives to come and just have this type of conversation is to make everyone intrigued and curious enough to start asking this question from their organization perspective, their
Yeah.
own organization. And the reason being is at the end, here's another kind of a statement that I think is important to put to your audience. In healthcare, if you analyze healthcare as a whole, especially in US from the technology standpoint, we develop more resources to help the physician than we do to help the patient, to make it easy for the patient. It's the only industry where the final client, the final
Mm-hmm.
customer, although we all say is at the center, we don't develop enough solution to really make them the center.
Yeah.
And I have a beef with that. And one of the things that do you guys use in London, you use the concept of beef. I have a beef with that, meaning I don't
Yes.
use that.
It,
Okay.
it's yeah. It's not very widely used, but yeah, it's more of an American expression, I guess.
Exactly. Yeah, and it's a
Yeah.
slang, right? Having a conversation. But for me is if it is true, and any EMR, EHR organization or leader that is listening to me right now, I'm challenging you with this question and see what's going to come about. If we know by a fact that most of the conditions that we're treating the patients with, they really these are chronic conditions that their treatments are palliative, meaning we have to treat them, yes, with medication, but the most influential part is life changing, right? From the patient perspective. That means if you have high blood pressure, if you have diabetes, if you have obesity, and so on and so forth, it is in the patient understanding the patient about their conditions, how to manage it, how to treat it in order to live a quality of life. We all know this, everyone, right? And we know that the complications of these conditions that are manageable, they really overload the spends in healthcare. Why is it that we do not put more emphasis in the patient education tools that we provide? Every single EHR system, at least the five major ones, they keep printing pages that they know
Mm-hmm.
the patients is not appealing enough to the patient to read, to comprehend. This is one of the areas where I think generative AI is going to make a big difference. And it's better if we do it from the healthcare standpoint and not from an outside organization. That information is accurate, or at least the context in which is accurate. We need to improve patient education. It has to be personalized, it has to be customized to the point that it should interact with the patient at the level of education and languages and cultural background of the patient itself.
That's a very pertinent point because doctors obviously don't have enough time to spend with the patients to educate them. And it's a, let's say, it's a half an hour visit to a doctor, and the doctor tells the patient that you've got, let's say, you're pre-diabetic,
Yeah.
and but they don't have time to tell them everything about diabetes, and that's where nurses step in, and even the nurses don't have enough time to fully educate them. And how do you think AI can resolve those sort of challenges, and how do you foresee the future of patient education?
Yeah. Man, now you're getting me into my soft spot.
Right.
This is my jam. So to
Mm-hmm.
say.
Right.
So as a professional, for the reason I say that, as a professional, I pride myself to be living and involved in human learning and machine learning, right in the middle of that. Um, from the patient education side, I think we have enough information already, and we have the technology that we can customize for each patient based on their record, their patient record, customize the information that they get as education, right? I think it's not. If we want it to be effective, you cannot put it in the responsibility of the medical doctor. And the reason is it's not just about the time, it's how much really that patient is learning at that moment. You know, uh, there has to be a lot of repetitions. There has to be there is definitely a vocabulary that the doctor might use for their training that is not as to the level of the patient. In country like where you live and I live, United States and London, which is our heavily there is many cultures, multicultural, which it has a big chunk in the educational piece, also have to play a role. So
Right.
in your question, I'm providing all those challenges as a context. The way I see it is that as this generative AI, you asked me about AI and keep bringing it to generative AI
Mm-hmm.
because AI we have for the longest, but this type of AI is really making a difference. As this generative AI technology keep becoming better, as we keep specializing them as agents, right?
Yeah.
I can definitely see a system that allows the patient's record in the diagnosis to customize a patient education library that the patient can utilize, right? And that I can have a chat with it just the same way you use Perplexity or ChatGPT or Cloud. I'm trying to mention all the popular ones, right?
Yeah. Yeah.
Just to mention one where you can ask, okay, based on my on the record, can you explain to me this the seventh grade level? What does it mean? Uh, Losing my vision due to diabetes, so that that it can explain from that perspective. And then the next step is, okay, now that I know that information, what can I do today
Mm-hmm.
based on my
Yeah.
record? What can I do today to minimize those risks? Okay, perfect. And then since you have access to my record, can you send me a reminder to do X, Y, and Z? It's a co-pilot for health. And we
Mm-hmm.
might not be far from that. Recently, I read the OpenAI and a wellness organization are teaming up to create a health co-pilot that
Yeah.
is complete, right? And I'm not sure because they didn't went through the technology integration. It was not a technological document, which is an article.
Mm-hmm.
But I can imagine that if they since it's possible for any patient to download their record from the EMR, and if they're able to be integrated, I can definitely see a tool that can do that. And as content keep getting better and better and better, there is one thing in generative AI that creating content like video, images, and then the reading content itself are
Mm-hmm.
becoming better at it. I can definitely see also for most of us that are visual learners that you
Yes.
can ask like, can I see a video? What's happening at the cellular level, and so on and so forth. When we started the discussion, you were asking me how I started my career in the technology healthcare. I started my career there in the patient education space, and I think one of my life's journey will be from this point on as I'm moving into have a little more influence on where the dollars will be invested. I'm heavily thinking on that perspective is how we can enhance the customization and comprehension of healthcare to improve the life of the patient itself. I think that we have to do way more on that area. So
Yeah.
I see generative AI really changing the game on that. As long as you touched a point a few minutes ago, there is an incentive for organizations to do so, and it's always about that, especially with healthcare.
So again, trying to sum up your vision for patient education, let's assume a patient who's recently been diagnosed with a condition, let's say asthma.
Yes.
Can you summarize the whole uh, vision in 30 seconds and tell us how would a patient receive education in future, let's say 5 years from now, uh, and how would that look like?
Okay. So in 30 seconds or less, wow, what a challenge. That as you can see, I make connections with my thought. I will
Mm.
say a patient
Mm-hmm.
will be able to make a connection between their signs and symptoms moving up or down in their experience through the information that is getting from these interactive tools. If you're telling me that if I take a walk every day for 30 minutes and I minimize the consumption of, let's say, sugar after 6 p.m., I will sleep better and I will see improving in my energy level. Then the system itself, and you're telling me those recommendations, the system itself is going to be able to track if I'm doing that. And then like a little game say, great job, you're doing this. I can see from your heart rate, from your from how fast you walk in the house, and so on and so forth. Your energy is getting level. I can see the tracking the time you're going to bed. You're having a better sleep, so you're already taking charge of your health. That's more than 30 seconds, but that's
Yeah,
how
no,
it
I
is.
think spot on. Yeah,
It's that constant interaction between me and my goals with that are for me. Not that I go to YouTube and look at video. Now, what does that mean for Engers Fernandez, the patient, as I'm interacting? And by the way, I think this is going to come, and I think I have said a few times, it's going to come from the patient forcing organization to do so, not organizations forcing the patient to do so. I think it's going to be a technology that is going to be driven by whoever innovative company come out with a way that in a very safe way can implement this type of AI, always taking into consideration, right? The challenges that we were talking about, the liability and so on and so forth. We're not going to go back there, but I think that's company is going to make a difference.
right.
The other piece, and I know probably we're out of time, but I think is helpful to mention. Uh, it is okay to regress in technology if the innovation will actually increase the quality of life. The especially with the electronic health records, taking into consideration as we see trends with natural catastrophes, right, that are very disruptive. Like let's say hurricanes. I live in Florida. Yesterday there was a hurricane passing us by where it can disrupt electricity, it can disrupt Wi-Fi, then disrupt healthcare. We have to, as we're reinventing the electronic health record to facilitate this type of uh, interaction with the technology for the patient's benefit, we have to start rethinking developing this tool, regretting to offline first type of technology and then
Right.
enhance when it comes online. That's one. The second one, for those EHR developers, we need to start thinking again mobile first, and the way we have been thinking about this. And last but not least, uh, I know that there is a lot of hopes and hypes about the latest version of AI, but this version of AI is here to stay, and
Right.
it's here to stay, and it's becoming better. The adoption level keep increasing as people learn how to interact with that more. We're ready. I think humans are ready to have an EHR system that is generative AI first, also that can
Yeah.
walk through the patient and can walk through the doctor and helping in their experiences.
And with that, we come to the end of this incredibly insightful episode. I want to extend a heartfelt thanks to Angus Fernandez for joining us today and sharing his valuable perspective on healthcare technology and innovation. Angus, your journey from pioneering 3D HD patient education tools to leading innovation at Ochin Inc. is truly inspiring. your insights to fostering a culture of innovation, balancing technological advancement with patient privacy, and your vision for future of healthcare technology have been incredibly enlightening. Thank you so much for shedding light on the critical role of technology in improving healthcare access and outcomes, and for sharing your experiences in leading digital transformation initiatives. Your advice for aspiring technology leaders in the healthcare sector is invaluable. Thank you once again, Angus, for taking the time to be with us on Drug Diaries, and we look forward to seeing how your innovative work continues to shape the future of healthcare technology.
Kaushik, thank you very much for having me, and thank your audience to listen what we have to say. I'm available in LinkedIn, where I usually post anything new that is coming out from what we're doing. And as I'm moving forward in this next journey with Next, there are 3 projects that I cannot wait to share when it's ready. And I'm looking forward for all the innovators that are listening to you, Kaushik, to jump in and lean in so we can really take healthcare, especially in those underserved population, to the next level. Thank you for having me.
Thank you very much, Angus. Have a wonderful evening, and hope to see you again soon.